My name is Mitchell Hillier. I'm the NFP lead here at Environics Analytics. It's my absolute pleasure to introduce Kim Fletcher today. As Senior Vice President of Marketing Communications, Kim leads Diabetes Canada's efforts to increase awareness of and access to information and resources that can improve the quality of life of those living with diabetes. Kim has 3 decades of experience in brand management, product marketing, fundraising, and customer experience with industry-leading organizations such as Procter & Gamble, KPMG, Microsoft, and World Vision. In today's presentation, you're going to learn about a project weaving in a primary research study with Environics Analytics data methodologies, showcasing how understanding the target audiences within Diabetes Canada's own database directed them towards optimized brand positioning strategies. So with that, please give it up for Kim.
Excuse me, I'm just going to switch my glasses here. You'll get to that age. I'm going to put your notes down here. Well, good afternoon, everyone. What a delight to meet so many of you. I had a chance to say hello and some friendly faces out here. That's one of the beautiful things about the not-for-profit sector is that we're all co-collaborating in one way or another. I wanted to thank Mitchell for introducing me, and I wanted to thank the Environics team, many that are here. I can see Jennifer, I don't know if Alan's here, for all of your expertise and support to help our organization have a stronger impact using the funds that are graciously given to us by donors. You've been wonderful partners to learn with and to learn from, so thank you for that. As I go through our time together, I'm going to try and keep it to about 20 minutes, 15 minutes, so maybe we can have some time for questions. I want you to walk away and learn 3 things. And I'm a charity, and I'm a health charity. So one of them is, I want you to understand the prevalence of diabetes in Canada so that you yourselves can be healthy. I want you to, 2, know that data-informed decisions can make a meaningful contribution to your organization's bottom line. And 3, I'm going to introduce you just very briefly. You're going to have some commercial moments to people who live with diabetes and they're advocating with us. And when you see their faces, I want you to think they're not responsible for their diabetes. And if you yourself are living with diabetes today, or a family or a parent member are, though there's things that we can do to help mitigate our diabetes, you are not responsible for your diabetes. Your family member is not responsible for their diabetes. And I want you to know that in your heart, and I want you to hear that from me, because we hear it in our research and we hear it in our testimonials that quite often friends, families, media, even our doctors can sometimes give the impression that we're actually responsible for our diabetes. For over 70 years, Diabetes Canada has been educating healthcare professionals, authoring clinical practice guidelines, and providing resources and support for people affected by diabetes. We advocate federally and provincially for equitable access for diabetes medicine, supplies, and devices. In fact, our very smart and very determined CEO, Laura Siren, is going to be giving her testimony in Ottawa next week for Bill C-64, which you may have heard as the Pharmacare Bill. We've also been funding research in Canada for over 50 years with really smart and talented researchers who are searching for both a cure and ways to improve the quality of life for those who are living with the condition today. Most recently, we've been shining a growing spotlight on the misperceptions and incorrect information around diabetes in the Canadian narrative that often talks about stigmatizing and discrimination behavior and languages for those living with the health condition. And why are we passionate about all these things that we do? Well, I wanted to give you some facts. Because diabetes is impacting us and our friends and families at an epidemic level. 4 million people in Canada have been diagnosed with diabetes. We estimate there's over 1 million more who have diabetes and don't know it. Well, that's a really meaningful statistic for myself because my father only learned he had diabetes after having a heart attack, and heart disease is just one of the many complications of diabetes. In addition to the 4 million who are diagnosed and the 1 million who have diabetes and don't know it, there's an estimated another 6 million people who are either pre-diabetic or have a high propensity to get diabetes. That's over 11 million people in Canada. That's a big number. And as I was just talking to one of our guests, it is a costly one for our healthcare society. So we at Diabetes Canada want to bring an even greater awareness to this issue. So let me share how Diabetes Canada and Environics Analytics have been working together for over a year now, quite honestly, to do just that, grow our brand awareness, and through this greater awareness, we can achieve healthier outcomes. To give you some context, I thought it might be interesting to go over our brand history, as it might be a similar journey for some of yours if you are in the not-for-profit sector. Looking back in time, we had a different name, and maybe you recognized it, called the Canadian Diabetes Association, and that's our name and our logo. And we did some brand research, respondent base of just over 1,000, and we were found to be conservative and old-fashioned. That thought, you think maybe you do a brand rebranding. Yet in 2007, that was what's expected of a health charity, and we actually also scored as 44% as appropriate to be both conservative and old-fashioned. So at the time, back in 2007, there were no changes made. Going ahead to 2017, the organization decided it wanted to appear and appeal to younger demographic, so it changed its logo, color palette, and name to Diabetes Canada. However, they only soft launched it. As a charity, we watch our funds very carefully in terms of where we spend them. And we decided to swap out collateral as it was used up. Well, this was a very messy transition, and it took quite a bit of time. So the organization didn't run a brand campaign. In 2018, the organization thought, okay, we're just about finished that transition. We're through the collateral, so let's actually do a benchmark and see where our brand health is. And they ran those data points, and I've shared a little bit of it here, because what we were trying to do was figure out how big could we get in terms of awareness? How big of an impact could we have? And they developed at that time a brand platform called Let's End Diabetes, and it was around a cure concept. And they were going to run a brand campaign after Diabetes Awareness Month that November. Well, COVID hit, the campaign didn't launch, and CEOs changed. So fast forward 2023, we had to start the whole process all over again. Not surprisingly, when we ran some brand health research, we found that both aided and unaided awareness had dropped quite significantly with the continued lack of brand investment. A bright spot on the data, however, was of those who were familiar with our brand and mission, their propensity to give was strong, and that's a great thing for a charity. So the opportunity ahead of us with Environics was twofold. One, in the short term, let's grow our brand awareness amongst those who are already familiar, because that would increase our giving. The next was to figure out how to improve our overall brand awareness. The question we wrestled with is, do we go with the brand campaign and brand positioning in 2017, or do we go to something new? The second option would require us getting board approval and to possibly walk away from the existing brand positioning. As most of you can agree, the market in the not-for-profit sector has changed quite substantially since 2017, so the team recommended we develop a new brand platform. To get the approvals to do this, because it was going to require some funding, we would need a robust business case. We began a project with 3 partners to conduct both quantitative and qualitative brand research, to do a deep segment analysis, and if approval was secured via the business case, we could also develop new brand positioning, a new brand platform, and a new brand campaign. Environics, in many ways, acted as our quarterback to this complex project, which was very important, as we needed the research to have our objectives top of mind. We needed the data, both quantitative and qualitatively, to support what we were trying to achieve. The primary research studies needed to be integrative and additive for us. And to simplify this year-long project for today, I'm going to focus on the audience segment work. So if you can think, the brand health research, quant and qual, is finished. And at this point in time of this use case, we don't yet have approval by either senior leadership or the board to change our brand positioning. Meet Chloe. Chloe is a beautiful, resilient person, and she's a model in our Pumpkinshire fashion show. Chloe was diagnosed at the age of 4. She and her family have experienced a lot of stigma. Many of their friends and family, when they were diagnosed, thought Chloe got diabetes from eating too much sugar, which isn't the truth. Children in her kindergarten class stayed away from her because they thought they could catch diabetes. You can read more on how she and her dad are advocating for diabetes in our 2023 impact report. And I show you Chloe because as we talk about big data and we talk about segments, we always, particularly in the health cherry, we want to keep in mind it's Chloe we're trying to help and to serve. So, focusing in on the audience segment project. Environics started by reviewing our full database and cleaned it to be a master file. They cleaned this file along with their own proprietary files, and this comprised the foundation of our analysis of where we started with them in that project. Step 2, and I know some of you are looking to do this, so I did break it out in step 1, 2, and 5, so you can follow along that this is step 2. Step 2, next, they analyzed the data sets and with their own proven methodologies came back to us a recommendation of 9 audience segments that they proposed we consider targeting given our specific mission and goals. If you haven't worked with PRISM data before, or personas, it can be a different way of looking at your key constituents. To help members of my team, because I've been using it for some time, Environics brought it back to us in a way that they could be familiarized with it. They mapped their recommended personas with how DC typically groups our audiences. And they showed us how each persona indexes to our target audience groupings. The higher number in red, that's the higher we index within our own database. The lower number in blue, DC indexes lower. Important also is the percentages, because they show the penetration we have of the total market size of that segment. And I like to think of this as kind of my share of the market in that persona. Both the indices and penetration can guide our marketing activities, both the type of activity and the investment level. For example, a high index may lead us to do more stewardship-like activities. Or if we have low market share but we have high penetration, it could actually encourage us to do more investment in there because they're more of the type of people who are involved with us as either as donors or service provider. You may recall in my brand history timeline that the research we did in 2023 had a sample size of 3,000 respondents. In the previous 2 times, they had a sample size of 1,000. And this was very intentional to go bigger this time because research is an investment. And I wanted to maximize the use of this research across the whole organization. So we added minimum quotas for key diabetes factors such as gender, age, type of diabetes diagnosed, geographical dispersion, high-risk communities, and for diabetes that includes Indigenous, South Asian, and Black, and other factors. This allowed Environics to cut for us the data along each of these variables which were relevant for us with each segment, giving us some rich insights and guiding us where to focus. We all agreed 9 segments for an organization our size was just too much for us realistically to use into action. So we streamlined down to 5 priority segments that fit best with our mission work and our fundraising work. We then began qualitative work, and importantly, we overlaid other quantitative research, such as our social living experiences research, with each segment to build a more robust profile of each persona. And this is helping us tailor our messaging and media targeting. And a shout out to Environics researchers here. They just did also a huge survey for us and offered to ask a question about postal codes, which was a voluntary. So we can take that entire first-party data set from that research and I can overlay it onto this research. You might wonder how we're going to use this data over time. And here you can see as the segments are all tied to the postal codes, we can be more efficient and strategic regarding what marketing activities to be put into which segment and which geography, tailor the reason they should believe our messaging, and personalize the call to action to be unique for them. You can see here I broke it out into 4 areas that probably are pretty familiar to you if you're in the not-for-profit segment: to cultivate, to steward, re-engage, and to maintain. This is super helpful for our DM team, our door-to-door team, and even our social media and digital media buying team, because it helps us with lead generation, but it also helps us with making sure that we continue strong relationships, either for an upsell or a cross-sell perspective. All right. What about the business case? I left you an Easter egg a little earlier. I said we needed this data to do a business case. So all this research was leading us to write a robust, evidence-based business case to present to our senior leadership and to the board. Recall, in my use case here, we don't have approval yet to move on to any new brand work. And the brand team has decided that the 2017 brand platform is not relevant for today, given the insights we have. And so we're going to need an investment, and we needed a willingness to explore something new. We needed to ensure everyone was on board, and that's so important with data that everyone in the organization is agreeing to use it and sees value in it. Now, if you have been in the not-for-profit marketing sector for a while, you know, and from experience, and I'll just say from doing it for a long time, in my heart, that strong brand is the tide that rises all fundraising initiatives' probability of success. In short, a strong brand inspires donors, and inspired donors give to your cause. You'll also know convincing your board, who are weighing off many different investment areas such as new technology, a new mission program, purchasing equipment, it can be hard to convince them that investing in brand is a good investment, and it also requires several years of investment. That's me, the board member, saying, no, you can't have funds, Kim, but maybe if you put a donate now button on, you can, and those of you who are in the industry know that's not really brand building at all. So, to equip the team as they write this business proposal, I asked Environics to use all the data we now had to answer this important question. Hey, for every 1% increase in brand awareness we could get, how much would regular donor giving give by? Well, with this data, we could then calculate how much to invest in brand for increments of desired awareness brand growth. Meet John Farrell and his son, Ryan. John has type 2 diabetes. Ryan has type 1. Both are ambassadors of Diabetes Canada, and both are dedicated to reducing the incorrect information and incorrect perceptions about why people have diabetes, and to reduce the stigma that often goes along with this diagnosis. So, Environics. To answer this challenging question, they first used DC's data to create a formula to show our marketing funnel conversion rates between awareness, familiarity, and giving. Then, they used our own donor history to calculate the incremental donors we could attain with a 1% growth in our brand awareness, and calculated, given our average donage rates, total donage growth over time and within a year. Gives you an idea of how the mental math went. Then, in scenario 2 here, they reality checked this potential donor growth with their own data. These two scenarios gave the team a range for both the number of donors and donation growth potential for each brand awareness percentage growth point, theoretically. In turn, the team could use this data to decide how much to recommend to leadership to invest in the brand work for every percentage point of growth that they wanted to commit to. EA then related this data to each of the specific persona for Diabetes Canada that they had recommended based on their presence within DC's database and the Canadian market. This comprehensive data analysis gave us the additional insight we were looking for to go forward with an even stronger business case to leadership. Well, what happened? Well, both our senior leadership and the board both supported the direction the team was recommending and agreed we could pursue this new brand work, and that work is currently underway. They're so cute. Meet 2 of Diabetes Canada's campers. We run 9 medically assisted camps across Canada, so kids with diabetes can go to camp and just be kids. It also gives their parents a chance for a break and knowing their kids are among other people who live and experience the same things they do. Some takeaways. Well, not surprising, they're all data related. Data we have found and consistently know that data provides better insights into audience segment behaviors and values. It enables us to have more informed and evidence-based decisions, which in the charitable sector is really important and it's sometimes hard to come by. Data helps optimize our marketing campaigns for better returns. We can do door-to-door more efficiently now in a lead gen way, right down to FSAs, which is super important for us. We can also solicit neighborhoods that are more likely to need our services or more likely to have a propensity to give. It can help us guide new investment opportunities or choices between investments, and which we have found very significantly with this massive research undertaking for the last almost 2 years, it can be blended to answer big business questions. And particularly for an organization our size, we often require some expertise on how to extract that full value. And so I wanted to thank you for some time. I'm happy to take questions. For those of you I've talked to, if you have any further, because I've touched on quite a few things, connect with me on LinkedIn, and love to chat a little bit more about what we're doing and how I could help you with this. Thank you.
Thank you very much, Kim. We do have time for questions. We have about 10 minutes, so if anyone has any questions for Kim, please raise your hands. I can pass this microphone to the people in the front. We have a colleague who can pass it out in the back. Yeah.
Hi. Thank you for the presentation. It was very informative. So my name is Benhaz. I'm from the Princess Margaret Cancer Foundation, and I'm wondering. I'm assuming that this analysis with Environics was done as a static analysis. Is there, and if it is there plans to kind of what is the future of taking this analysis to the next level? Is there a dynamic prospecting kind of model in plan for your analytics team? So you're constantly rerunning your personas and your models, and every year you find new targets or perhaps new personas to constantly engage with different areas, and constantly changing your brand campaigns and such to always be in touch with new markets and trends.
Yeah, thank you. That's a complex question, so I'll do my best to answer it. I think both the Environics Analytics and the Environics research team would say our relationship's not static, because they're all on speed dial. So it's an ongoing series of projects, and that's twofold. One is complex data takes time for organizations to fully unpack and extract the full value out of it. So we have lots of questions, and they provide us terrific counsel on ways we can use the data. Second is you have to actually develop the materials based on these insights and then put them into the marketplace and then test, A/B testing, continuous testing, to see if they're resonating, and then go back in time. And one of the reasons I showed you the brand health history is it's important every so often. In bigger companies, they can go in more frequently, but for our charities is to go back every few years and do a robust set of analysis to say, are we actually having the intended impact we want to have? And in that second part is to have patience. It takes quite a while to change people's perceptions in a very crowded marketplace. It's hard to break through with messaging, so we have to have board level patience, and we also have to have research patience. So that's a way to answer the question. Is it's not static, and I have no desire to make it static.
Thank you.
Thanks. You mentioned you had something like 15 segments, but you only selected 5, and I noticed you didn't select the largest one. Can you just elaborate? Was that more art than science? Was it just based on past history? If you did it again, would you have picked 7 segments instead of 5 or 4? That's kind of a tipping point for this whole thing, but can you just elaborate a bit on that?
Sure, yeah. I think there was multiple science. So they came back with segments. They came back with 9, and us as a team, we picked 5. And I think that comes down to, as a charity, we are serving the Canadian public. So where is there a higher propensity of our condition in the health sector that we can help? That's one. Where are they? And we want to be there. Second of all, where are there segments that have a high propensity to give? We're a charity, we need to fundraise, and we want to be there. The highest concentration of where our charity resonated and there was room for us to growth came down to 5. If we were a larger organization, I think that you would see that some marketing may go into that last 4, but it's diminishing returns. And so we're going to focus on our highest priorities, given our budgets and my team's capacity, on those highest ones. So they're ones that we index high in, and we have low market share in. So we know that our message and our cause resonates with them, so we just need to do more of that. And then we have one which is we're under-indexing, and it's kind of weird because we should be, given their profile, we should actually be over-indexing, we're not. And so we're really going to go in with a different strategy, which is really about prospecting and lead gen, because we want them to be aware because they have a footprint that resonates with us, either in the mission products we're offering or the charities or the types of causes that they like to participate with. And so that's where we got to 5. It wasn't a question of, draw the line at 5. This is where we, 6, 7, 8, 9, we actually saw diminishing returns for what we were willing to invest at that time.
Hi, thank you for the insightful presentation. I think when you started out, you said that there were 2 main focuses. One, to convert your awareness into more repeat donors, and then the second one, to grow your awareness. And it seems like the business case tackled that second part. I'd love to better understand how you're working towards that first part and increasing repeat donations and retention among the donor base.
Absolutely. At the top of the marketing funnel, it's just costly to build unaided and aided awareness, and so that was the business case, and so thank you. The immediate step that we did was to build our brand familiarity of those who are already aware of us, and so in those personas, we already know whom, based on mapping our data from the brand health over top, who have higher awareness. And so we did that within existing budgets. So we refined our existing messages to really focus in on who is brand diabetes, what are the offerings that we have, and what's the impact we have. And we did that with existing donor dollars and existing marketing programs. And so we were able to take what we were doing, which was acting somewhat in silos. Our high net worth was going down one path, our direct another, and our social the other. We really kind of started to bring them together and weave through consistent messaging. And that's building the brand familiarity while we're tackling that other problem of awareness. The good news is if you bring brand familiarity, our conversion rate to regular giving is actually higher than some of the other in the sector, and so we're actually seeing higher returns on that.
I think we have time for 1 or 2 more questions. We got one over here.
Great presentation, really interesting. I was curious just if you had some top-line thoughts around how these kinds of data might help refine in the future or align thinking about how to position, for example, Diabetes Canada along with heart and stroke. And the reason for that is, and I know you know well, and the audience may know, there's a lot of innovation happening in the medical field right now. A lot of the leaders are actually referring to the field as cardiodiabesity rather than diabetes or cardiac, et cetera. And so how do you play with, I suppose, your collaborator charities, your competitor charities? How do you position yourself? And can the data help inform some of those decisions?
Yeah, great question, and that could be a whole nother talk because that was the part that I didn't get into. So I just have the money and I'm doing that now. But I'm further along that I'm giving indication. So the one thing in the charitable sector I like to say is co-opetition. We partner with the diabetes charities and associations in Canada and globally because we have a common purpose. We also partner and we also compete with other national health charities, hospitals, because we have a declining pool of donor dollars. That is our reality. But we do it with, I hope, a greater degree of respect and with grace and with some just intentionality about that. And so we are working that through. In terms of our brand positioning, what I didn't get into here, but I can share quickly, is those insights when we mapped all sorts of data sets is really allowing us to say what resonates with those 5 personas. What's the messaging that works with them, and why is it working with them? And that's where we have actually developed and we have approved a brand new brand positioning. I have a brand new brand platform that we're just finalizing, is going to be going to the board imminently. And then I'll start work on a brand campaign. And so that's what we're working through. And there's another map where you take all of the charities and you put what they stand for on. And we've mapped ourselves and kind of find your white space that's unique to us and unique within the diabetes ecosystem, and quite honestly is authentic to us, and where should we be speaking out. And that mapping is the exercise we've done, and we have that, I just don't have time to share. Thanks.